message to the billionaire class: you can't have it all.
Welcome, everybody, to another episode of the Evolution of Now. A episode that almost didn't happen today, actually. We were, was on the edge of our seats today, and we almost didn't do it. But we're here today, and we're finally going to get into it. I am joined this week by my good friends Jordan and Aubrey.
Hello.
And we have some news to bring to you guys from the week, or the 2 weeks here, really. So, how have you guys been doing this week, though?
Whoever can think about it first.
That sounds, yeah.
Go Tensai.
Oh, all right, fine, I'll go. Well, it rained ice, and then it snowed.
I think that's called hail, isn't it?
Well, yeah, that might be about it, yeah. It was very much like hail, actually.
Yeah.
Yes. Yeah, just fun times for all. I do have a free Starbucks drink waiting for me if I can ever get out of the house.
Ooh.
Nice.
So.
Well, that's something to look forward to, at least. Yeah.
Nice.
Yeah, they still
Are you like a Gold Star member?
Yeah.
Uh-oh.
I spend way too much money at Starbucks.
I know. I used to be a Gold Star member too. I fell from grace.
So that means you're probably going to be supporting, what was his name? Something Schultz for
Howard
president?
Schultz.
Howard Schultz for president? Huh?
No.
Exactly.
And it's funny because he's the former CEO. He isn't even the current CEO of Starbucks. He resigned what was that, 2 years ago?
Was it 2 years ago?
Wow.
It was a year or two. I'm not sure exactly how long.
Okay.
Last year or the year before. But yeah. And it's funny because Starbucks actually sent out some talking points to all their staff, everywhere, saying, hey, if anybody asks about Howard Schultz, just, say he's not our CEO anymore. We are not the book. Views are not the views of Starbucks or Starbucks employees. If you have any further questions, please go to our what is it? PR
website?
Department or whatever it's called.
Yeah.
Yeah,
Obviously, we're not here to talk about Howard Schultz, but I think the most ridiculous thing. The most ridiculous thing. I know, right? But someone interviewed him, and they were like, "Oh yeah," and he talked about how great it was that he he provided health insurance to most Starbucks employees by I think he raised the price of certain items, and then in contrast, he's yeah, but Medicare for all isn't going to work. It's just it's pie in the sky. It's just not possible. And it's wait a second, but you can just apply the logic that you use at Starbucks, and but yeah, it just doesn't. Fucking, we're not here to talk about Howard Schultz, and he's not going to win. And also, I am not intimidated by him. And even if he does decide to run, I am not afraid of him.
So look at his policies. If you look at his policies objectively, you could just be well, he's not going to get any Democratic votes.
Yeah.
So if he does run, who's he going to poach votes from? Not going to be the Dems.
Maybe the establishment.
That's what I mean.
Maybe he'll take some of the establishments. I don't know.
Well, and even the establishment people, they're going to be more likely to lean more towards Harris.
Well, yeah, but at the end of the day, after the primary, if it's Bernie Sanders, Schultz, and Trump, they might put their weight behind Schultz. I could see that at least.
Yeah, but the thing is, if they're willing to vote for Schultz over Bernie Sanders, despite knowing Schultz ain't going to win, then that means that either they weren't going to vote in the first place in that situation, or they would have voted for just a random third-party candidate.
Yeah. Also, no party loyalty then there too, I guess, for him, I guess.
Interesting. Yep.
It'll be a catch-22 for him, I suppose, which will be fine with me. I hope he stays in the race, and I hope he fails miserably and he is ostracized. As he should be, because the guy is just effing lunacy. But anyway, I guess we should go back to our actual topics for the day. I don't know who wanted to start today, but how about Jordan? You want to start today?
Yeah.
Sure.
Just throw it to you, Jordan.
I mean, you know what? It's appropriate. You did say Kamala Harris like a couple minutes ago. So I guess I'm trying to make like
it's pronounced Kamala. Thank you very much.
Is it really?
I think it's Kamala.
No,
yeah, I believe it's Kamala.
Oh, I thought it was Kamala.
No.
Yeah, me too.
I believe it's Kamala. Yeah. I could be wrong. Maybe I'm wrong. Maybe I'm the wrong one here, but you know.
Okay.
Fake news if that's not the case, but you know.
Yeah. So yeah, you know, actually, it's like Naruto. It's like some people say Naruto, and some people say Naruto. I still don't fucking know. I don't know. I don't watch it. But
it's Naruto because it's a Japanese name.
Yeah.
It's Pokemon, not Pokemon. Anyway.
Oh yeah. So okay. So my topic is about Kamala Harris's pass as a district attorney of San Francisco, and also as an attorney general of California. And this derives from an article from the Washington Times called, quote, Kamala Harris's law and order pass threatens, quote unquote, progressive 2020 bid. Uh-oh. And obviously she was amongst one of the first to throw her hat in the race. And she did that by announcing that she was, that her stance was justice reform one. That was her agenda. And she actually, really, really oddly, actually, I can kind of hear myself speak. I'm getting a little feedback, so it's kind of weird, so it's throwing me off slightly. But just saying.
Yeah, I think that's Tensai, sad, or Aubrey, really. When,
I don't know. My mic
it's
was
weird.
muted, so I have no idea how
I think it's
Anyway,
But anyway,
get back on?
Yeah, it's just super weird. So in 2004 to 2011, Kamala Harris served as district attorney of San Francisco, and within that time, she pushed for and this is the one that you plug your ears, Tensai. I know you're annoyed by this, but she pushed for a law to prosecute parents of habitually truant children, including fines and jail time, which actually had the potential to affect marginalized communities more than others. Also, as district attorney, she intentionally withheld info about wrongdoing by a police drug lab technician accused of sabotaging tests and stealing drugs. A judge eventually scolded Harris for her indifference to systemic violation of defendants' constitutional rights. So pretty much saying like you have a history of just not caring about the violations of defendants.
Yeah, I just wanted to add there was even that one clip of her talking about how like she's gonna like lock up parents for not putting their kids in school or something like that.
Yeah,
and,
being truant.
Like laughing about it too, but like I think they even did have a truancy law like that she also prosecuted. So I don't know. It's just
she doesn't live down that push, that law push at all. Like you said, during a town hall with I believe CNN Jake Tapper, he asked her about it, and she was pretty jovial about it, and like you said, also laughed or giggled about its the potential side effects that it could have. But moving on, almost done with her as a district attorney. She successfully fought an attempt to overturn the conviction of a George Gage for sexually abusing his stepdaughter, despite revelations that the prosecutor unlawfully held back potential exculpatory evidence. such as medical reports showing the stepdaughter repeatedly lied to police and was described by her mother as a quote-unquote pathological liar. So
It's really messed up how often prosecutors do that kind of thing, like withholding evidence. It happens like all the damn time in our system. It's amazing to me.
It does. And of course, it's just to present a more favorable success rate.
Yeah, exactly. They want that win ratio to be as high as they can, so that makes it look good for them later on in their career. Yeah,
exactly. Yeah, and as a prosecutor, their primary goal is not really so much justice as it is to successfully argue to put the person in, get a guilty verdict.
Right.
Once it gets to the prosecutor, it's no longer really about justice on their part.
It's supposed to be about justice, but yeah, it just doesn't work that way.
Well, see, that's what the courtroom is supposed to be about. That's what the judge and the jury is supposed to be about. As far as the prosecutor and the defense attorney, they're not supposed to necessarily be about justice. They're just supposed to argue their case.
Yeah.
And obviously, they're going to try to win their case.
Mm-hmm. It's almost by any means necessary, and it's unfortunately how the system's kind of just how it's designed. So yeah. And the thing is, a public figure, I think maybe like it was like an activist said something along the lines of, look, if Kamala Harris didn't want to, if that didn't align with her ideals, then she should have never took that job. Like it comes with the territory, but she took it, and obviously it must not have been a problem because when she became Attorney General of California in 2011 to 2017, she kind of continued some of this behavior. And so I have a little list here, starting with she appealed a federal judge's ruling in that the death penalty was unconstitutional, despite recently claiming that she is a lifelong opponent of the death penalty. So she decided not even to backtrack. She just decided to rewrite history recently and just to say that she'd never been against the unconstitutionality of the death penalty. Like she always thought that it was, but that wasn't the case. When she was a district attorney, she was for the death penalty, and like I said, going as far as appealing a judge's ruling that it wasn't constitutional. And then next, she fought legislation that required her office to investigate officers involved in shootings. That one's very problematic and goes against a quote that I'm going to give to you later on. Next thing is that she opposed statewide use of body cameras, which is also, which is now, I believe, a federal
might be like requirement. A guideline, right?
Yeah, which is now a federal requirement. However, at the time, she was against it. And also not voting well for her, justice reform agenda. And lastly, she moved to stop death row inmate Kevin Copper, whose trial was marred by racism and misconduct, from getting a DNA test to prove his innocence. She did not reverse course until a newspaper drew national attention to the case.
So who's ready for Kamala Harris in 2020? I mean, I know I am.
Right. And the only reason why we're bringing these things up is because she is running as the justice reform candidate, and she went as far as when just to put things in perspective, she was someone that's never really brought attention to her ethnicity or racial background, especially specifically politically. She never even mentioned how that was an important factor in her career politically up until now. And during her announcement of running for president, she was quoted as saying, "Let's speak the truth that too many unarmed Black men and women are killed in America. Too many Black and brown Americans are locked up. From mass incarceration to cash bail to policing, a criminal justice system needs drastic repair. Let's speak the truth." And so when she was actually in a position to spearhead a lot of those, a lot of things that she is now claiming that she's going to push for when she's president, she didn't do them. and so so that's a huge problem, and like a glaring red like a glaring issue with her agenda. Lastly, I just want to bring up what the civil rights advocate said. A civil rights advocate based in San Francisco. Her name is Felicia Jones, and she says, "quote San Francisco has always incarcerated more Black men anywhere else in the state, and it didn't really change under her leadership. Now she wants to do criminal justice reform. She never did say anything about police brutality of African Americans, and just the outright harassment and racial profiling of Black and brown people here in San Francisco. Now those are huge issues. So yeah, she's painting she's saying what all of us are thinking. Like now it's finally becoming something that seems to be important to her. And this is somebody when she was up for her bid for the Senate in 2016, Elizabeth Warren and President Obama both endorsed her, and most Democrats in the Senate did actually. Like this is someone who had the full support of the Democratic Party despite all these big, huge problems in her past as district attorney and attorney general. So this is really important to bring up. I really wanted to just talk about Kamala Harris and put her record in perspective. Because some of these things are things that she's not owning up to. Some of these things that during a town hall that she's circumventing. The recent town hall that she had with Jake Tapper, she just circumvented his questions, or a town haller's question regarding her criminal justice past, and she decided, instead of addressing a lot of the things that I brought up here, she decided to champion the things that she did do while she had those titles, and she did do some positive things as well, but I mean, you can't move on until you address the issues that you have or that you've had. So, that's all America's really asking.
Sounds a little bit like, to me, Kamala Harris running as the criminal justice reform candidate is a lot like Freddy Krueger running as like the homicide reform candidate. Because her record's just really bad on it. I mean, maybe that's a bad analogy, but
that's probably. That's
I don't know.
It's pretty harsh.
No, it's a little harsh, I suppose. Yeah. But...
as a Black YouTuber I was watching earlier on the topic said, I mean, she's top cop.
Yeah.
That's basically what he's been describing her as.
Yeah.
And I've also seen a lot of Black YouTubers bring up the fact that she's not actually. She comes from a fairly well-off background.
Mm-hmm.
And she's also not a descendant of American slaves.
Mm-hmm.
I mean, her father was half Jamaican, right?
Yeah, he was Jamaican, yeah.
Yeah, and her mother was Indian.
Mm-hmm.
And so, I mean, she doesn't have the same history of systemic racism within this country. I mean, obviously Jamaica's got its own problems, but that's...
Yeah, definitely.
Different from here.
Yeah.
So I mean, it's so I think in a ways, very similar to Obama, there's a lot of, I mean, yes, she can face a lot of the stereotyping and stuff that comes from having a darker colored skin, and people just kind of lump all Black people in together. But that doesn't necessarily mean that she really has a shared experience with someone who's actually a descendant of slaves in this country and who has been systemically kept down and profiled and arrested and or faced discrimination and segregation and stuff like that. That's not in her family background.
Right. Yeah, that's a really important thing to bring up, and I'm glad you did, because that's a determining factor in how you review certain racial scenarios and topics, and as a Black person, as someone whose ancestors was involved in slavery, were slaves, and having friends who either are from Nigeria or immigrants but are also Black as well, there is a difference in how we view the criminal justice system and how we view the America at large. So if that is really that is a determining factor in in her views of justice. And so
yeah.
Also, I as we, since we're talking about the racial dynamic of Kamala Harris, I do want to bring up how she is getting a boost because she is a Black woman as well. So that is actually helping her in this race. So it is important not to. I also brought up the story because I don't want to get lost in just that, in just what she looks like. She could look like me, but the fact that she has a background of suppressing or marginalizing, also marginalizing people that look like me is a problem. And then in stark contrast, we have someone like Bernie Sanders, who hasn't announced his bid yet, but hopefully he will soon, who doesn't have that background. And of course, he does have issues in terms of his lack of appropriate responses when it comes to marginalized communities. But he doesn't have a history of specifically trouncing or having policies or championing policies that hurt marginalized communities. So that's a huge difference. For me, at that point, her Blackness doesn't even matter when it comes to racial justice, because once again, her history shows that it didn't seem to matter as much when she was in those high positions. So
yeah.
But lastly,
Oh, go ahead.
But just before we move on, I do, and it's stupid. I hate this does have to be brought up, but I do want to highlight some positive things that she did as a district attorney and as attorney general, which are great. But once again, to me personally, it doesn't override the hurt that she's done to these communities. So, for instance, number one is that she implemented implicit bias and procedural justice training for police. She created a public data system for deaths in custody and arrest weights by race. She created one of the first re-entry programs in the U.S. To provide jobs, training, and counseling. And also she corrected backlog of rape kits in California, which are all really good things. But like I said, she has the answer to the detrimental things that she pushed for and got passed as a district attorney and attorney general.
Yeah. Yeah. She, I guess she's a mixed bag at that point, but.
Oh, sorry. I thought I unmuted.
There you are.
So I was saying, I think a lot of that goes back to her, she is a Black woman, so she would be much more aware of profiling problems and stuff like that. So she would take steps to address that. And, but I think being not from the same background as, you are, Jordan, I think she really deeply underestimated the systemic problems within the justice system. And it probably wasn't obvious to her.
Yeah.
Because everybody around her was telling her it was normal.
Yeah.
So, call it what you will. I think a lot of that is just simply she didn't have the background necessary to really understand and repair the damage that has been done with our systemic racism in our justice system.
Yeah. And I know, just for comparison, some Black voters looked at Hillary Clinton sideways for her super predator comments. Now, I just want to compare, Hillary Clinton's comments to the actual actions taken by Kamala Harris. I actually think that's what Kamala Harris has done is more detrimental than what Hillary Clinton has said as First Lady over 20 years ago. I truly think that Kamala Harris has done a lot more damage than anything Hillary Clinton could have said from then up until now. Like Hillary Clinton, her husband's a different story, but once again, it's and it was a big like a huge issue that she had to address, Hillary Clinton, but and she eventually did, but Kamala Harris just really has to, and I think, and I hope more people pay attention to this so that we have an accurate representation of who she is, so that we're not just blinded by the fact that it will be a great progressive. It would be very progressive to elect a black woman as president. As great as that is, and as that sounds, the quality of that black woman president is so much more important.
Hillary really never actually addressed things too well, in my opinion, and especially with regards to Black Lives Matter and everything. And you remember that one video where she was talking at a private event, and that one black girl stood up in front and put up the little sign and started talking to her. She just shouted the kid down until the security guards got her out of the room, and then she just went back to what they were talking about. And she had no care at all for that movement or that girl or any of it. Whereas when Bernie Sanders was famously approached, or they jumped the stage and went to the mic, he stepped back and let them talk.
Yeah.
He let them get their say in, Yeah, I mean, that should say something to people. She answered them with vitriol, and Bernie Sanders answered them with allowing them to speak. And freaking establishment people, they never fucking learn.
Yeah.
Yeah.
And I think also the question is, who do we want to be the first black woman president? Do we want it to be another, person who's a child of immigrants and comes from a wealthy background, or do we want it to be someone who's actually managed to make it despite all the odds against them to rise up through the ranks? Do we want it to be an actual descendant of slaves, or do we want it to be another immigrant wealthy president, which is what we got with Obama, unfortunately.
And before we move on, just for clarification, I was specifically talking about her response to the super predator comments. She did on multiple occasions she's denounced her previous statements, but of course overall she has been terrible at addressing her past of insensitivity towards marginalized communities. So yeah.
I guess. Unless you guys got anything else to say on the matter with Kamala, because I know Kamala came into Iowa recently and had a nice little town hall. I think Aubrey really enjoyed that one, from what I remember.
I caught parts of the speech. I didn't watch the whole thing, but it was pretty infuriating.
But you know what? Yeah.
I was just going to say, I heard that she had a decent response when it came to Medicare for All. And then the day after, her campaign staff walked it back completely.
Not even 24 hours later.
Yeah.
Yeah.
So.
Yeah.
You got to be careful with them, too, because the thing is, it's not about what they say, it's about what they don't say a lot of the time. One
of my main problems with Kamala Harris is she has given zero policy specifics. She's used very vague terms, and she doesn't even have a policy or issues page on her website.
Yeah, sounds like the establishment to me. That's why people hate the Democrats right now. They don't have specifics anymore. The Democrats don't have specifics. The establishment. All they care about is the bullshit rhetoric that, I don't know.
To draw a contrast with Tulsi Gabbard, she has, a ton of policy specifics on, virtually any topic you can think of.
Mm-hmm.
And it's Tulsi Gabbard has her issues. She has her issues. But she has her policies out in the open for us to look at.
Definitely. It's so weird because, initially when Elizabeth Warren announced her bid, I was, all in. But as time progressed, it doesn't seem like she's really putting in as much as some of the other candidates that are that are in the race, and one of them being Tulsi Gabbard. Like Tulsi Gabbard is going hard, and so like right now, Tulsi Gabbard is like is looking like my number one, up until Bernie, of course. But yeah, just saying.
Yeah. Yeah, I mean, she said some really great stuff, Tulsi, and I don't know. She is a mixed bag. But yeah, I guess we should move on to our next few stories. I know I have one. I don't know if you wanted to go first, Aubrey, with yours.
Oh, you can go first. That's fine.
All right.
Mine's a discussion one, so.
Yeah. I wanted to mention Puerto Rico and how that situation in Puerto Rico still hasn't been resolved. Like, a lot of the island is still in ruins, and a lot of it is a mess. But I want to go further into that in an episode coming up, where I can actually take a little bit more time and delve into it. I kind of didn't have enough time this week to go more into it. But my main topic this week is an article out of NPR, actually. The title of it is "Patients Suffer as Insurers and Big Health Systems Spar for Market Share." And so the article starts out by saying, Anthem Blue Cross of California, one of the state's largest health insurers, is battling Sutter Health over how much it should pay to care for tens of thousands of people it insures in Northern California. Sutter operates 24 hospitals in the region and lists about 5,000 doctors in its network. Contract disputes between the insurers and medical providers have been a regular feature of the national health industry for a long time, but the stakes have risen as big players on both sides have expanded to gain market share and leverage in network negotiations. And I took a few highlights from the article I wanted to go through, and we can talk about them as they come up. But most negotiations are completed before the old contract expires, and consumers usually don't hear about these behind-the-scenes disagreements. But when insurers and providers fail to reach an agreement on time, it can force patients to pay higher prices for care that is no longer covered by their health plans. At the least, it can cause considerable anxiety. And there's a quote here from Wendell Potter. He was a former senior executive at health insurance giant Cigna. He's become a critic of the industry, apparently, which is pretty good. He says here, quote, "It is a game of chicken, and at the end of the day, somebody blinks and they come to an agreement." Quote, "The big losers in this are patients, though. So because there is a period of uncertainty and angst and a real possibility that the physicians and hospitals you want to go to are no longer in your network." And so what exactly is happening here is these, I get it, like the health system, the hospital system wants to get paid more, and the insurance system doesn't want to pay them as much. You know, there's always going to be a push and pull here, you know, and the problem is, at the end of the day, there's people's lives and health in the crossfire here, you know, and these companies just seem negligent to some degree, you know. But there's a quote from a Sutter spokeswoman named Amy Toma Tan. She said, in an emailed statement, quote, "We are in active negotiations with Anthem Blue Cross and recognize that a timely agreement, one that protects access and choice, is in the best interest of our patients, employers, hospitals, and clinicians." And that to me sounds like some bullshit. They're not really giving you specifics. It's just, oh yeah, we're really going to try and do this as quickly as possible, and we want to protect the access and choice of everyone. And like, I don't know.
Yeah, you know what the problem here is? It's these networks. The in-network, out-network. Well, you know what? If we had a Medicare for all system, a single-payer system, everybody would be in network.
Right.
Because they would all take Medicare.
Yeah.
Yeah. Yeah, protecting quote unquote access or communications and access and all that. I mean, let's be real. That's not their ultimate their ultimate focus. That's not their ultimate
focus is
reason
to
to
make
exist.
money.
Exactly. There's a profit incentive. So like at the end of the day, that's every company's real incentive, real goal is to just maximize their profit. So at any cost, because the CEOs on the line, or the CEOs on the line, and exactly. So and the board members, they have decisions to make, and so definitely Medicare for all is the only alternative that can that can make sure that we don't fall into these traps, that we don't become just numbers on a board, or, that we're more than that. We actually deserve to have access to these to healthcare services. Like right now, I'm uninsured, and because I don't have a job that offers health insurance as an option, and also I don't have enough to afford it out of pocket. So once again, health insurance companies don't give a shit about that. They're not extending their services to people who can't necessarily afford it.
Yeah.
What other alternative do we have?
Yeah, I mean, well, and I'm on Medicaid right now, just because I don't have a job and I'm going to school. But I mean, it was amazing switching to Medicaid. How much freedom I suddenly had. I was no longer afraid to go to the doctor.
Yeah.
Really?
And I mean, like, I remember a couple years ago, I actually had a fairly good health insurance plan. I was working, at a big financial company and all that. And it was probably one of the better health insurance programs offered in the state. And I had to go to the emergency room. A year later, I get a bill for $1,000.
Yeah.
Jeez.
I mean,
this is the kind of stuff that people worry about. This is why people don't go to the doctor, because they're afraid of all the other bills they're going to have to pay.
Absolutely. I mean, prior to not being uninsured, I was Aetna, and I can tell you the countless times that I would get a bill in the mail, despite being with a health insurance company, talking about from the doctor's office, talking about they were unable to they were unable to get be in proper communications with my health insurance provider. So here's a bill for this much just for a normal checkup. And then I have to go out of my way to contact my health insurance company, talk them through the whole process.
Yep.
And then, exactly. And then get them to take care of the bill itself, despite it being something that should have already been taken care of from the get-go, something that that they guarantee that they do, and that they a service that they offer, and that they despite being uninsured, there are still complications that you have to go through.
Yeah, and I mean, like, my roommate, he's a kidney transplant patient. I mean, he has to go to the doctor like every week, for regular checkups and stuff like that on various things. And, I mean, the amount of times he has to sit there and wait for the insurance company to approve every single little thing, whereas the doctor's like, yeah, you need it. This is what I need from you. This is what procedure I need. And the doctor signs it. And then it should be just, okay, we go get it. Except no, we have to go and check with the insurance company to make sure it's okay, that they're actually going to pay for it.
Yeah. Seems to me that there could be some things that we can easily do to make our system better. But,
we could easily streamline this system.
Yeah.
And also, I mean, like, people have also been throwing up this whole, you want to outlaw private insurance. It just shows to me that they don't actually know what they're talking about with Medicare for All, because in Canada and the UK, they still have private health insurance companies.
Mm-hmm.
They still exist. They still make a profit.
Yeah.
They don't make as much of a profit.
They wouldn't be in existence if they didn't make a profit.
Exactly. I mean, they still make plenty of money, usually off rich people who want private rooms.
Yeah.
But
yeah, I mean, that's one way. I think that's what I heard Canada does. If you want to pay for a a private room, then yeah, you can do that in Canada. Yeah.
But like, just real quick, when your argument is, so what's going to happen to the private health insurance company? You know, then there's a
You're
problem.
already looking at it from the wrong angle.
No, that's already the wrong perspective.
You know, like I saw someone on Twitter arguing that, you know, oh, there's all these nurses and doctors and pharmacists working for the health insurance company. It's like, yeah, and you know what? If we had Medicare for all, we would definitely need to hire more nurses and doctors and pharmacists to work for Medicare.
Yeah.
Doing the exact same job they're doing now.
Yeah.
Exactly. Meanwhile, people are dying because they can't afford decent health care. Yeah. Like, come on, what's really your argument is something aside from the fact that people are dying?
Yeah.
Yeah.
And I mean, there's a reason why the nurses unions are really pushing for Medicare for all too. You know?
For sure.
When you've got the nurses pushing for it, that should be a major eye-opener going, oh, okay, this is something we really actually need.
Yeah.
Yeah. They should be the arbiter when it comes to discussions like these. Like, you know, we should, I mean, I feel like people should be turning their gaze towards the nurses and the doctors when it comes to issues like this. Yeah, politically as well, you know, not just in terms of like how it worked. You know, so, you know.
Back to the article, though.
Oh, sorry.
No, it's okay. There's actually a statement from the spokesperson for Anthem Blue Cross as well, who apparently also lacked details on his response, too. You know, how great the response from Sutter was. This one is, quote, "As we negotiate with providers, we try to strike a balance between protecting affordability and providing a broad network of providers to create choices, which can take time." So, you know, it's all the milquetoast rhetoric of not saying anything. But
platitudes.
But not even in California is that the only place that's having these problems. Apparently, in Western Pennsylvania, nearly 50,000 people with Medicare managed care plans from Highmark Health will lose in-network access to University of Pittsburgh Medical Center hospitals and doctors starting July 1st because of a slow-moving divorce between the two regional health giants. So they haven't even come to a deal. It doesn't even sound like they're going to be coming to a deal because they're going through a slow-moving divorce, it's showing here. One of the patients that's going to be affected or is affected by this is by the name of Judy Hayes that they put in their article here. She is a 75-year-old retired office manager from the Pittsburgh suburb of Crescent Township who relies on UPMC's physicians and hospitals to treat her rare form of leukemia. Now she plans to change her doctors mid-treatment because she wants to keep her insurance, which she says has paid for her expensive medications. And she's quoted here, "It's very tough. These people have been taking care of me for the last 9 years. I can't have any interruption with my care. I'm very angry about it," you know, and as she should be. Like this kind of upheaval in your care is ridiculous. Like, but these companies just don't leave people options to do anything else. But there's also Georgia that's also going through issues with a Wellstar Health System with 11 hospitals and numerous medical offices, plans to stop accepting Anthem's individual policyholders as in-network patients on February 1st or 4th, amid a contract dispute between the two companies. There's also 2017, an impasse between Anthem and the Hartford Medical Care System, or healthcare system in Connecticut, forced hundreds of thousands of patients to go out of network before the two parties finally inked a deal. The patients' bills were retroactively treated as in-network, so patients didn't suffer financially, but there were some people that had to cancel treatments and surgeries in that, and that just throws all of their plans into chaos just because these companies want to quibble over money, you know. It goes back at the end of the article back to the Sutter Blue Cross Blue Shield or Anthem Blue Shield strife here. It says Sutter has quarreled with other insurers, including Blue Shield of California, in a dispute that affected about 270,000 consumers before the two sides reached a deal that took effect in February 2015. Sutter's market dominance in California and its high prices for inpatient care have long drawn criticism. One patient reported that Sutter charged $1,500 or $1,555 for a 10-minute emergency room visit to treat a cut finger. And I definitely have experience in that too myself, actually.
Wow.
I've had that kind of thing happen even for like a few years back. Well, a few years, like maybe close to 10 years now. I worked at a culinary kitchen thing for a mortgage company, and I cut my finger with a deli slicer. It wasn't like super bad, but it just wouldn't stop bleeding. So I went to the emergency room, and they were trying to hand me a bill for, I think it was at least $600 something back then. And
Jeez.
so, I mean, that stuff does happen.
Yeah, well, I mean, my $1,000, well, actually it was like 980 something or whatever. I don't remember exactly. From going to the emergency room, that was from a burn.
Jeez.
I was in there for about 30 minutes. And I think my insurance company paid like $600 or $700. So, I mean,
Yeah.
you consider they still sent me a $900 some check or bill after that.
Yeah. Yeah. But going back to this for a second here, that one patient that reported charged $1,555 for that visit, that included a $55 charge for a gel bandage and a $487 charge for a tetanus shot. That's crazy. That's a lot of money for just a gel bandage and a freaking tetanus shot.
Anywhere near that much.
Yeah.
Yeah.
It's the inflation of medical devices and stuff. I mean, like, so we basically decided when I broke my ankle, I was using a knee scooter. And we decided to rent a knee scooter from like a medical device place. It turns out we rented it for, what was it, 2 months? Maybe 3 months? 3 months. And basically, the price that we paid them to rent it for those 3 months would have bought me a brand new scooter for like, actually, we'd still have money left over.
Yeah.
Wow.
And the one I was using, it was we rented it from like a medical device outlet.
Okay.
Jeez.
Yeah, and the one that we rented, it was a really old and banged up scooter. It was extremely wobbly, and I actually fell off it twice. One time I actually broke my toe falling off it.
Jeez.
Thanks.
Same foot I broke my ankle on.
Oh man, that sucks.
And yeah, the other time I fell off, I don't think I really hurt myself, but yeah, it was very easy to fall on that thing, and the brakes didn't work great either.
Oh, great.
So yeah.
That's some business model. Just making money off of people that have low information. People who aren't aware of the fact that.
Yeah. It was only later that we realized we could have bought one and saved ourselves some money and had one that actually probably worked properly.
Yeah.
That's criminal. Like like the reason I support Medicare for all is I'm basically saying I don't trust that big business will look out for my best interest. Like,
oh yeah, definitely not.
Yeah, like Medicare for all is basically us all linking hands together and saying we got this. We'll take care of this shit ourselves because because no one is going to look after us except for ourselves. So we have to do it.
And we're coming to this decision basically 100 years before most of our allies came to this decision.
Yeah.
Mm-hmm.
So I mean, we're definitely behind the times here. Us backwards Americans.
Yeah, but it's a decent article. I'd suggest anyone out there, if you want to look all the way into it and everything, go check it out. It'll be in the podcast details and stuff. So it's this healthcare system needs to change and monumentally, revolutionarily, and needs to change. You know, I think we need a green new deal that encompasses Medicare for all.
Shout out to AOC.
Yeah. AOC
Well,
is bae, I will say. I love AOC. She's amazing.
But yeah.
So,
Hey, I have no problem with her taking on the Green Party's policies there.
Yeah.
That was one of the things I really liked about the Green Party.
Yeah.
But
so which leaves us to your story of the day,
turn.
Aubrey.
Okay.
Yay.
So, for context for this story, I'm not sure how many people are aware, but we have a law that was passed in July of 1990 called the Americans with Disabilities Act, also known as the ADA. This law basically means that every place has to be handicap accessible. There was effective dates. Basically, some places were given much more time to become compliant with the law. However, those deadlines have long since passed. I mean, it's been
almost 20 years.
20 years?
Over 20 years, right? Actually,
Yeah, over 20 years. That's 1990, so that's almost 30 years now.
Jeez.
So, yeah, so it's been almost 30 years since this law was passed. I think actually, 29 years?
Yep.
So more than enough time for pretty much everyone to become compliant, right? Right?
Yeah, it should be.
Anyone been to New York City lately?
Oh, yeah.
You guys live closer to it than me.
You know what? I was going to bring that up too, because one of my best friend is in a wheelchair, and and she has trouble. She's from New York and has had trouble navigating it, and it has been. You know, is now here in New Jersey, and we frequent Philadelphia quite often. And thankfully, Philadelphia is better in terms of accessibility, and as things as little as having a ramp, not even like one like formed outside, like, you know, out of concrete, like a little handheld one that they can bring out, you know, so that she can get her way in. But yeah,
and you know, that sort of thing, you know, where you can, you know, where like there's older buildings in town here that just you can't put a ramp in. You can't really make it handicap accessible. But if you have certain ways to kind of get around it so that you can still actually serve everyone who wants to or needs to come in, that's a massive thing.
Mm-hmm.
And that also makes you compliant with the law.
Exactly.
I mean, like I said, I broke my ankle last year. I was on a knee scooter and then a walker, and now I'm using a cane. And I learned very quickly how far we still have to go for handicap accessibility. But I came across a story last week that made me realize New York City has some major problems. Namely, only 24% of New York's 472 subway stations are ranked as accessible, according to a report by New York City Comptroller Scott Stringer, which is the lowest rate in the country.
Yeah.
So,
Jesus Christ.
I mean, I actually have experience in New York City at a Penn Station, because I actually went through there a few years ago. TYT was at this StreamCon, I think they were holding in Manhattan, and I went in through Penn Station, and that place is horrible. There's so many horrible things about the subway station there that I can remember. Like it was in some ways you could see like the old value to it and everything. There were like there's monuments to the past and everything in there. It was kind of interesting, but like the stairwells in that place, going from the subway ramps up to like the upper area, were just really, really cramped and tiny, and the stairs themselves were somewhat steep, and I didn't remember seeing an elevator or anything around. And another problem was I found it weird at first when I was going home that we were sort of like sitting upstairs, or like standing upstairs, like not on the subway ramps. You know, we've always all seen, like, in the movies and stuff, people are standing at the thing waiting for the train to pull in. They just walk right through the door and they're gone. You know, we were all the way upstairs and waiting for it. I was wondering why that was until we got downstairs. When we got downstairs, it smelled so badly of human feces. It was insane how bad it smelled. And it was a nightmare, that place. And like, there were so many homeless people there, and it was just, it's heartbreaking just to see so many people just that live in a subway station because they don't have anywhere else to go. And
Yeah.
God damn it.
Yeah.
It was just,
And the thing
it was all horrible.
Okay.
Yeah. But I was gonna say, like, just being able, you know, I noticed that, like, that we have a tendency not to even consider the accessibility of life, you know. And the only reason why I became aware is because my best friend is someone that's in a wheelchair. But like, that's the important thing. That's why it's so important to have representation. If not like on the board, at least have like an advisor come in and you know, make everyone aware of these kind of things. But yeah, I mean that's also a part of why a lot of, you know, things when it comes to accessibility aren't being tackled, is because like a lot of it is just comes from a place of not even being aware of how inaccessible some of these places are.
Yeah, and I mean, like, I didn't even quite fully understand it. I mean, like, I understood it a little bit, but I didn't quite really understand the accessibility problems that you face when, you know, you are not able to freely move around. And I mean, like, I wasn't even like, I mean, I was on just a knee scooter and then a walker. You know, that's not even like wheelchair bound or anything like that.
Mm-hmm.
And I mean, I had the hardest time getting out of a building when the elevator broke down.
Yeah.
Because there were stairs I had to get up.
Oh,
That
goodness.
I was luckily there was a guy I was able to kind of scoot up the stairs on my butt, and then a guy kind of basically picked me up and put me on my feet because I couldn't stand up. So I was lucky.
Good Samaritan.
But yeah, it was. But anyway, so back to this particular story. So there is no such lift at the 7th Avenue station. There are 2 escalators that go up, but there is none going down, and as well, they do not advise taking prams or baby carriages or whatever you call them, strollers.
That's ridiculous.
They don't recommend taking strollers or wheelchairs on them either, for obvious reasons, because that's extremely dangerous. I think, yeah. Anyway, not to get sidetracked here, but anyway, so last week, a young mother who is 22 years old, named Malaysia Goodson, was trying to go home from New York City from a day of shopping. She had her 1-year-old daughter with her, Riley, and she had her daughter in a stroller, and she was carrying a bunch of bags because, you know, she'd been shopping. She was trying to carry the stroller down the stairs, and then she apparently fell, and she was found dead at the bottom of the stairs. The daughter was okay. So yeah, Malaysia
That's so
Goodson would be
tragic.
alive today if there'd been an elevator at that subway station.
Yeah, and apparently, like, other mothers spoke out as well, and to talk about how they've always feared about going down those steps, or just avoid it at all costs because of like the risk.
Yeah, I can almost feel like maybe like if people maybe use like those chest hoist things for their child more often, maybe that might help instead of having to use those. But yeah,
the thing
it still
is,
sucks no matter what.
That requires strength.
Yeah.
And it's not as easy as just simply, we'll use different options. I mean, like, I found another article, which unfortunately I have lost, but they sent a reporter to that specific subway station, And while the reporter was going up, she saw a mother coming down the stairs with a stroller with twins in it.
Jesus.
And she actually helped the woman carry the stroller down. And the woman was like extremely thankful and everything, but she noticed that like literally nobody else even stopped to even offer help.
Yeah. But that's a great story to bring up too, because like, yeah, what if you do have two babies? Like, you can't have a harness for that, you know?
Yeah, you know, and it's one of these things where, I mean, I kind of went off on Twitter, not that probably anybody noticed because I'm like a nobody, but you know, basically.
Oh, I don't see that.
Yeah, but I don't have much
We're
Twitter
big
following.
league
I think
over
I have
here
like
at TEoN.
less than 100 Twitter followers, and probably half of them are bots, because you know that's how it always works, right?
Yeah.
But you know, I mean, like I went off and I basically said that every single New York City mayor since 1990 is responsible for these women's, you know, injuries and deaths, because a lot of women have been injured and killed from this.
I remember you also linked a story that was sort of tangential to this, where it was saying,
that.
Yeah, okay. I just wanted to.
Okay, I kind of wanted to cover this here.
Okay.
But yeah, it's something that I think New Yorkers really need to force their officials to hold them to it. I mean, de Blasio says that there's plans in place to get enough elevators in place by 2025, so no rider would be more than 2 stops away from an accessible station. You know, that's great, you know, but that's still 6 years away. And looking back on it, saying, hey, this has been the law of the land for almost 30 years now. Why are you just now getting around to this?
But that still says, though, that not all stations are going to be accessible anyway, still.
Yeah,
you know?
exactly. I mean, that's still, like, that's a major improvement, but that's still...
Yeah.
I know, it's frustrating. And apparently the $40 billion proposal for this plan hasn't even been funded yet. Meanwhile, we have Amazon putting in a new headquarters in New York City, and the city's apparently going to a lot of money for that.
And actually, I just read a headline earlier today where that actually is in doubt now, because Amazon's fees were hurt a little bit, and so they might be pulling out of New York City now. So
good.
So there was a quote from their spokesperson earlier today, and they had this to say.
Oh God.
Oh.
Yeah. Anyway.
But anyway, so my other story here actually also comes from the BBC. It's titled, "Why Don't People Give Up Their Seats on Public Transport?" And, you know, it's just basically kind of a piece about people kind of speculating why people don't really, you know, give up their seats to, because, you know, like the first couple seats on a bus or, you know, like sitting down on a train is supposed to be for people who are like handicapped, elderly, mothers with young children, pregnant women, stuff like that, right? Someone who obviously needs to sit down, right?
Yeah.
Well, people don't really get up and offer their seats very often, apparently. And so I just kind of wanted to use that to talk about our experiences with public transportation, and how this kind of ties in.
Yeah.
So like I ride the bus here in Iowa, which I know a lot of people are like, they have buses in Iowa? Yes, we have buses.
Are they made out of corn? Oh, sorry.
No, although they do use corn fuel.
I knew it.
They're hybrid buses in my town.
Well, that's good.
In Ames, Iowa, where Iowa State University is. And the main reason why we have such an awesome bus system here is because it is about 50% funded by the university.
Nice.
And based around the university.
Interesting.
So, yeah, well, part of that's because parking is at a major premium on campus. So the more students they can encourage to ride the buses, the better. And at the same time, they also serve the community, which helps make the community be, you know, it helps ease some of the tensions between the college crowd and the people that live here full time. I happen to be part of both, but so I mean, it's kind of one of those weird dichotomies. Students ride for free, but we also pay for it in our tuition. So there is that. I'm technically paying for the bus.
Yeah.
But one thing that I've noticed here is on certain bus routes, it can be very difficult to get them to give you a seat. Even when I was on the knee scooter, that was the fun one. I've also had my own struggles with getting buses to stop and let me on when I was on the knee scooter. Sometimes they would just speed right past, or they would try to tell me they were full and wouldn't let me on. And I was like, dude, I can see there's standing room, or I can see that there's room. There's room for me on the bus. And nope, you've already closed the doors and moved on. All right then.
Jeez.
I emailed them and I got hold of supervisors over there, and that behavior stopped really quick. But because that's a lawsuit.
Yeah.
But I mean, this is something that handicapped people do have to deal with. Most buses can only support 2 wheelchairs at a time. So if there's already 2 people in wheelchairs on, you have to wait for the next bus, however long that is.
I have audio of when Aubrey was talking to the bus company.
I'm in a rage! This is the maddest I've ever been!
So that was what she was like when she was on
actually.
the phone with them. So,
yeah. Yeah, I didn't call them. I just sent them an angry email.
Well, it was conveyed.
It could have been worse. I could have sent them a sternly worded letter.
Very strongly worded letter. Yeah. Oh,
yes.
man.
Yes. I think that's the level of elevation there. But yeah. So I mean, and it can be very annoying, especially when you see essentially a young jock, and I mean someone who's very obviously a jock. Like muscles up the wazoo, and they're wearing like a sports shirt and all that. And they just glance up at you, and then they look right back down at their phone, and you're like, dude, I need to sit down.
Yeah, yeah, there's a lot of indifference in people nowadays, and especially like, I mean, there's been studies that show people just do not help others sometimes, especially in like crowded areas. Someone could be like, there could be a dead body on the street, and everyone just walks right past it because, well, everyone else is walking past it, so why should I stop? So,
Yeah.
I mean, mind you, most of the people in this town, they see like an elderly person get on, or a handicapped person get on, or a young mother get on, etc. They get up and they move. They immediately offer their seat to them, and I mean, it's occasionally on certain routes where I run, where specifically one route, where I tend to run into people that don't want to move at all. And yes, it is usually the most crowded bus too, so maybe that's part of it. It is also the bus that goes directly to Walmart, so take that as you will.
Yeah.
I like reading Walmart for things. It's fun.
It's so easy.
I know, right? But I mean, I'm sure I'm not the only one here who's ridden public transportation.
I haven't done much on public transport. I did that one train ride into NYC, but I mean, I haven't really gone much on buses or anything myself.
Yeah. No, I have my own experiences. And I know people who've had experiences who are handicapped. And so, like, I mean, like, personally, I do have, like, a set of rules. If a person looks over a certain age, then I, will easily just, ask them, hey, would you like to sit here? If it's, or not even just, based off of age, if they look like they could use it, then absolutely, but yeah, I've also experienced people who are just like not even concerned about the other people around them,
Yeah.
Yeah, it's. I mean, and I hate to say it, but at least around here, they tend to be right out of high school, about that age group.
Oh no, you can shit over high school kids all day. Like,
I hate to shit on like
These
people
goddamn
that are going to
Generation
classes,
Z's.
but yeah, it's not even. I think it's a lot of it is just ignorance. Like they don't quite understand how difficult it could be for some people and everything.
Get off my lawn, you little bastards! That's
And just to be fair, there are a lot of very
Yeah.
responsible and knowledgeable high school kids. When I said that, I was specifically thinking about myself as a high school kid.
Yeah, I wasn't exactly a prize either. But
I'm sure we all have had our stupid moments in our past when we were kids. I know I've probably done some really stupid, ignorant, and selfish things in the past, and there's not much I can do about it now. But it is something that we have to understand. It's just kids are gonna be kids, you know. And I always hate the narrative that oh, this is the worst young generation ever. No, that's what they've always been saying since time
everybody
immemorial.
shit when they're young.
Everyone always does that. Exactly.
Kids are the worst, horrible things ever. And then they grow up.
I love Louis C.K.'s argument where he says, kids are too responsible today. They care too much, you know?
Well, yeah, they're out there protesting and stuff, saying, hey, we're tired of getting shot up at school. Stop it.
Yeah.
Exactly.
Or actually standing up to the UN and telling them, guys, we need to do something about climate change because no one else is fucking doing it. There's kids doing that kind of stuff. What was that?
Yeah,
was that the World Bank or the UN? I can't remember what it was recently.
I don't know.
Remember anymore. Shit.
But I also need to mention the glaring issue, which is manspreading. And yet, that is also a problem, and I witness it too often, especially witnessing it in 2019. It's like, come on, there's been there's been Tumblr pages made about
hold on. Hold on. Okay, let's define what manspreading actually is so people know what we're talking about. Manspreading is when you spread your legs to the point where you are taking up more than one seat. That is it. What manspreading is.
That is it.
It is not just sitting in there with your legs spread. It is spreading your legs so you take up more than one seat.
That is the issue.
I'm safe then. Okay. Because I will say, sometimes when I'm sitting somewhere, it is hard to completely close your legs all the way or anything like that. That's super uncomfortable.
Anybody telling you have to sit like that, they don't know what the fuck they're talking about.
Yeah.
And they're just being upset to be upset. No,
seriously.
The problem is when they take up more than one seat. Especially when seats are at a premium.
Exactly, yeah. I was going to say.
And especially when it's one of those big muscly jocks sitting in the middle of 3 seats, spreading his legs so he takes up all 3. And then he won't move.
Well, that guy is a player. That's what it is, That's really what it is. So, he's a cool guy. But, yeah. Meh. It sucks, people... kids definitely can be very, self-centered in a lot of ways, they don't really think about, decency, in certain situations like that, maybe. They're more thinking about, oh, what am I going to do with Brad's house, later today, and then they cry about it while they write it on their calendar. But, and Scooter. And,
that one.
Sure.
I'm sorry. It was a stretch.
Sorry,
it was a stretch.
People don't do that.
And who's
right
Brad?
on their calendars? Come on. We all do that, don't we?
That.
Kavanaugh?
No.
Kavanaugh does it.
Yeah,
Ooh,
Kavanaugh's a loser.
And he cries whenever he talks about Scooter.
For fuck's sake, who holds on to a calendar from high school?
I know.
Throw that shit away.
Yeah.
I know. It's just
even back when you didn't have it all on your phone or whatever, back when you actually had a physical calendar on your wall. Even if you wrote in stuff to remember where you were going and stuff like that, or remember what was going on, you threw that shit away. You didn't keep it.
Yeah, it's completely unrealistic.
That's someone who's living in the past.
Well, that is the ideology there. The conservatives, that's what they do, is they live in the past.
Yeah, true. True.
It is part of the ideology for sure. Yeah. But
exactly.
Yeah. Did you have anything else on those stories, Aubrey?
No, just that. I mean, and that is a very interesting read to read through a couple of the different explanations and stuff that they give. But I think I just kind of wanted to talk about the problems that we've seen and maybe highlight to other people who might travel on public transportation. Hey, watch out for this kind of behavior, kind of police yourself. Are you making space for other passengers? Are you taking up extra seats when you don't have to? Keep an eye out for those who look like they need to sit down. That kind of thing.
Are you
Be a decent human being.
spreading too much?
Yeah. Exactly. Just awareness, just public awareness. That's all we're asking.
I mean, are you leaving, and I mean for any of our female listeners, are you leaving your purse on the seat next to you and refusing to let someone sit there?
Yeah.
Don't do that. Pick it up and put it on your lap.
Yeah, I can see that. I can also see an argument when it comes for women, at least. I don't know. As a woman in this country, it seems like you have to be a little bit more defensive than
the thing
a man does, with their personal space.
I'll leave my bags, when I go grocery shopping, I'll leave them sitting on the seat next to me until I see that the bus is filling up and there's very few seats left.
Yeah.
Then I'll pick them up and I'll put them on my lap.
Yeah.
I don't know. Of course, I live in a Midwestern town too, so I mean, it's...
Yeah, maybe I'm just looking too far into it. It just feels like maybe there might be a psychological reason for women to want to leave their purse there to make sure that no one else, some creepy guy, doesn't sit by them or something like that. I don't know.
Yeah, and I don't know, at least
just
in my
curious.
experience, when there's open seats, women tend to sit next to women and men tend to sit next to men.
Yeah.
Just because people don't want to be
Tensai just disappeared. Oh well, I think that might be the wrap up of the show here. So I think Jordan's gone too.
people probably
there
does
you are.
happen.
Wow, you just died for a second there for me.
Oh, did I?
Tensai.
I'm sorry.
Yeah.
Yeah, I've been kind of going in and out.
Yeah, I think that's a good
internet's
time to
bad.
wrap up though, because Jordan just disappeared too. He said he'd be right back, but I mean we are wrapping up anyway. So I mean, yeah. But yeah, it's some good articles, guys and girls out there. Definitely check them out. They will be in the description of this podcast. And thank you guys so much for showing up and listening to our wild rantings and recounting some news with us. We have a YouTube at this point. We actually have our audio podcast on YouTube. You can find it on there. We're on iTunes. Wow. Aubrey just posted something. Anyway.
Sorry. Distraction alert.
Exactly. Distraction cow says, I don't know. But anyway. But yeah. You guys have a great week. And Aubrey, you have a great week too.
Yep.
Yep.
Bye-bye.
Goodbye.